As nurses, it is our duty to recognize an ethical situation and help determine what that next action or decision is in those situations. The bell can have so much more meaning and significance than just the end of treatment. So work with your patients to define what the significance of that bell can mean as well.
You're listening to the Oncology Nursing Podcast, where ONS Voices talk cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Oncology Clinical Specialist at ONS. And today we're talking with ONS member Monica Cfarku, Associate Vice President and Chief of Oncology Nursing at the Duke Cancer Institute in Durham, North Carolina, about the ethics of redefining the bell that patients with cancer ring following the completion of treatment. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks so much for joining us today, Monica.
Thank you so much for having me. This is exciting.
What a fun topic. You know, there's many things, I guess, that are controversial in oncology and oncology nursing, but the one issue that I know anytime is brought up will have strong proponents on both sides is the bell. You just have to call it the bell. Everyone knows what the bell is in oncology. But, you know, I think recently many institutions have reconsidered if and how they use that bell. So let's start things off today. Could you briefly explain some of the ethical challenges that are associated with the bell for both patients and nurses? And to start, let's do patients. You know, why might the bell be difficult for them?
So, as you mentioned, the bell has typically been associated with completion of treatment, and the patient is now considered free of cancer. The challenge with that is when patients that will never get to experience that, because there are certain cancers now that are essentially chronic conditions, they hear that bell and that is not a good sound for them. That can bring, a lot of emotions around how they're never going to get to that point. And they're always going to be living with that cancer and have that sort of dark cloud hanging over them. So it can be a challenge for them. So having the bell in there and hearing those celebrations can be very difficult. In addition, you can have patients that are still going through treatment and they're not feeling wonderful, and having a sound, it can be a jarring sound depending on the kind of bell and how it's celebrated, and that can actually disturb their rest. Some patients get upset that they were woken out of a sleep because this is how they cope through their treatment with a jarring sound like that. So you wouldn't think that that's a controversial thing, the bell, but it really does create lots of different emotions for all kinds of people in our areas.
Absolutely. And then what about nurses? How do you see nurses being sort of affected by the bell, especially with regard to their nursing ethical practice?
What's really interesting and something that people don't really think about is you would think that answering a question such as, is there a bell to ring? And, subsequently, why don't you have a bell? And you would think that would be a simple answer and question, but it's really not. It's really not. As nurses, it is our duty to recognize an ethical situation and help determine what that next action or decision is in those situations. So we really need to be applying our ethical sensitivity. It is critical when answering these questions, and you would think it isn't, but it really is. This is because every single one of our patients, as I mentioned previously, experiences their cancer journey differently. It's a very individualized process. And as for nurses, that work to the top of our professional practice standards, we really need to have assessed their emotional response to this process, the cancer journey, or how the patient's response can play into our answer, right? So their response to their cancer journey. So we have a lot of things going through our head when that question, I know I did when I was first asked this question. So, number one is, how is the patient going to respond to this? Are they going to be upset? Will this cause disappointment? This can be really tough, right? As anything that can affect the therapeutic relationship between the patient and us as the nurse can have a really poor outcome. And we as nurses know that. So being able to ring a bell to signify the end of treatment isn't going to happen for everyone. So being in a treatment area and hearing the bell could be a beacon of hope for some, or a reminder of what will never be for others. So while some would think this is a simple question, again, it's really not that easy, because as nurses, we're not just thinking of the one, we have to think of the collective.
Absolutely. I love I think your first answer, you actually mentioned, that most infusion areas have some sort of community group feel to them. There are some private areas or private rooms, but there's usually some sort of more open spaces or open bays. And so it's a private space, but it's a public space. Anything that is experienced in that area cannot necessarily be shielded from anyone else. And that, of course, that matters to things like HIPAA and privacy, but also celebration. And as you mentioned, as patients are going through their treatment, everyone has a different mechanism to cope and to kind of persevere through that treatment, whether it's headphones or iPad or taking a nap or meditating or whatever. And so loud noises or celebrations or things, even if people are still supportive and excited for this patient who has reached that end of their treatment, it still can disrupt other patients' sort of just sense of calm and focus on what they're going through. You also mentioned towards the end, I think this is where I always felt a little unsure. I work a lot with patients who had ovarian cancer. And so they have great upfront responses to treatment. And so a lot of times they will get through their front line and have that opportunity to ring the bell. But we know that the rate of recurrence is very high. And so it's almost that dilemma of like, yes, I'm excited to celebrate this patient getting to this end of this portion of the treatment, but I know it's probably not the end. And sort of that dilemma of like, still wanting to maintain that hope, not be like a total Debbie Downer and assume the worst, but also just kind of knowing the clinical landscape of like, yes, you're done now, but I hope the patient understands that this is likely not the end, or has a good chance of maybe not being the end. And so there was that just the dilemma of like, I don't want to steal their hope. I don't want to like rob them of their joy and their celebration, but it's like, I just don't know that if this is really it. So I think nurses probably deal with that a lot, especially if they're subspecialized and know exactly what the landscape of that treatment trajectory might look like and kind of the statistics and the reality around recurrence or progression. As you mentioned, there's a lot going on in a nurse's head. So even if it's your patient who's done and they want to celebrate, it's like you do want to be there, but you also have all these other patients to keep in mind, and just knowing what that patient might still face in the future. It explains why something as seemingly simple as a bell can be so kind of rife with controversy.
Yeah, it's really interesting you mentioned the gyn-onc patients. We do a lot of clinical trials in our infusion area, right? And a lot of these patients, this is their second, third, fourth line of treatment. So having the ability for them to ring the bell, that can be real tough as well, right? Because these patients have already gone through quite a bit. That's a tough thing as a nurse to be confronted with that question when, you might have a patient sitting next to you that is, like you mentioned, is probably going to be back, or, this is their second, third, fourth line of treatment. And, prognosis may not be amazing. So,
yeah, I mean, it's tough to balance the various needs of all of the patients that are going to be within earshot of that bell. You might have a patient who just got news that unfortunately their cancer has progressed. And so they need to move on to their second or third or fourth line. And so what is their headspace and what are they thinking about? And so I think for nurses, this all makes sense to us. But as you said, trying to explain that sort of succinctly to patients who deservedly and understandably are like focused on themselves, on their own journey and their own experience. And so like, it's not that we expect a patient to kind of put the needs of everyone else over their own because they're going through a lot, but that is the nurse's role. As you said, we have to kind of fit in there and help bridge that gap to try to make everybody comfortable and celebrate those that want to celebrate, but also be there to just respect the needs of the patients who maybe aren't in the celebration mode at that moment in time. So at Duke, your team built a better bell ringing experience for all the patients by placing it outside of the institute and allowing patients to choose whether they wish to ring it or not. Can you briefly explain what led to that change and how you and your team implemented it?
So I'll try to be brief because it's kind of a bit of a journey for us. So I was actually here in my office and had received a phone call from a caregiver of a patient that had just completed treatment. And this caregiver was a cancer survivor herself. She wanted to talk to me directly to express her sadness that she got to ring the bell when she went through treatment, and the person that she was caring for, who was a family friend, a dear family friend, did not get to ring that bell because for her, for the caregiver, that was such a defining moment for her in her treatment. I had only been in my job probably 3 months and was still learning by fire hose.
Right.
So trying to figure out, and that was one of the questions that I asked when I first got here is, how do we celebrate the patient? Every place I've ever worked has always had a bell. So I happen to co-chair the Oncology Patient Advisory Council here at Duke Cancer Institute, and that is made up of former patient and caregiver volunteers that really help us drive a lot of our programs in a more patient-centric way. This is our way of getting the patient and caregiver's voice in a lot of the decision making. So I said, when I was talking to the caregiver, I said, that's a really good question. Let me bring this to, we call it OPAC. So when you hear me say OPAC, and that's our Oncology Patient Advisory Council. So I said, let me bring this to OPAC and see what they say. So I had brought this to them, and a lot of these members have been members of this committee for a long time, 3+ years, several for 15, 16, 17 years. So I brought this to them and they said, we've been brought this before. We're not really proponents of putting a bell in the infusion areas, and as outlined by what you and I just talked about. And a couple of my members are dealing with chronic cancer and are still getting treatment and felt very strongly that this was not the right way to go. And I said, well, what can we do? One of them said, why don't you survey the patients that are currently getting treated and see what they say? So I thought that was a fantastic idea. And what we did, you can't just give open-ended questions because you'll get a ton of answers, and that's really difficult to weed through. So we gave them 3 choices, the patients, and worked with my patient education manager and one of the clinical nurse specialists and some of the nurses in the infusion room. And we got this survey developed. It's through one of the survey platforms that we use here. We had a QR code, and the nurses would ask the patients to fill out a survey, and we got quite a few responses. Over 50% of the patients said they wanted a bell, which was great information to have. So brought this back to my OPAC group, and they said, well, the patients have spoken, and can we think about putting the bell outside of our cancer center? We have a tree of hope, and it's essentially where patients can go and rest and relax, and it's a very zen environment. And I thought that was a fantastic idea. This way, patients can ring the bell as they're walking in, ring the bell as they're walking out. And in addition, some of the other OPAC members said, it doesn't just have to be for treatment. At the end of treatment, it can be, this is the end of this particular journey, or this is to ring the bell for courage before I walk in. It can be used really for anything. And having been an oncology nurse my entire career and only knowing the bell as being a symbol of curative treatment, and I had never even thought of that, just never crossed my mind. We then pulled in she's our director of external relations, to see if we could get somebody to, an artist to donate the bell, and she found somebody. It's a wonderful piece of art, and it has the deepest sound. And then she also went to we have a patient advisory board that is made up of patients, former oncology patients and caregivers that help raise money, and brought this to them and said, how can we also use this as a way to raise money for Duke Cancer Institute? So we had a naming opportunity to name the bell, and somebody did. So we got some money raised as well for DCI. And the name that was landed on, which I love, is Sounds of Hope.
Oh, that's great.
It sort of encompasses what that bell signifies, right? So it was a long process, took a lot of people to get it done. And what was really fantastic is on the day of Duke Cancer Institute's 50th anniversary, we were having a celebration out there, and they literally put the bell in. The last brick got put in on that day.
Oh, perfect.
Just as the last brick was going in, a patient walked out and rang the bell. It was fantastic.
serendipitous. It was meant to happen that way, it sounds like. I love hearing how you went to the patients themselves and asked what they wanted. And as you said, every patient will want something different. Patients who have been a patient for a long time have a different perspective on their diagnosis and their treatment than someone maybe who's freshly in active treatment. But doing that survey, just hearing from patients that are currently in the midst of whatever phase of their treatment, I think the back and forth battle is endless because everyone has an opinion. And so it's probably a great idea that you did that because, I think one patient will have a very strong opinion and then sometimes administrators are compelled to do something immediately and change course to meet that one patient's concerns. And it's just like, you know what? There's got to be something in the middle that can meet the needs of everyone in the way that is right for them. So it sounds like that getting that feedback from patients and really taking that again to your patient and family council to get their support and their recommendations as well is definitely the right thing to do. Have you been able to measure or have you noticed how this has changed how your patients are affected if they hear the bell or when they ring the bell? Have you noticed any changes in the patient's psychosocial well-being?
My level, no, but I will share that what I have noticed is, so then again, the name of the bell is Sounds of Hope. And what's been really fun for me as someone who was directly involved in the project is I've seen patients ring it before walking into the building. And then when I'm rounding, seeing that same patient in the infusion area. So to me, when I see that, I look at that as the patient is ringing the bell as, quote unquote, good luck or to inspire hope and courage before they go in. So that always gives me a warm and fuzzy feeling. I've been asked to meet patients at the bell on their last day of treatment so they can ring it in celebration. So that's been really fun. I've seen, which honestly didn't even think about, right? I've seen non-oncology patients that are going into a different part of the campus and their family ring it. And I love to see that as our bell is being used to inspire hope and courage to so many other patients across Duke University. I've seen staff ring it. There's been a couple times where I said, yeah, that's a great sound. And they said, yeah, well, I need some hope in my life right now. So I'm ringing this to give myself hope because it's a tough environment to be in right now in healthcare and in nursing. So this little project has really had a reverberating effect that I and my OPAC did not even anticipate. It's those moments that I feel so proud of what we were able to accomplish and how that little bell, is maybe not so little, it's a pretty big bell, inspires hope and courage in people. And when they're walking, into something that can be a really scary time for them.
Now, I don't think you mentioned, so do you have any sort of I know some bells have like a little poem you say or words you can recite, not that you have to, but so does your bell have any of those descriptors about its intention or is it just the name on a plaque or something like that?
It's ring the bell to spread hope to the Duke cancer community. That's what is on the plaque. So it's the name and then that underneath it.
I think it's important to have some of that information to help guide people to understand what it's meant for, because I think a lot of people might still associate it with the former way it was used or the end of treatment. And so having the name that you gave it, which is broad and encompassing of all who need hope and providing just a short explanation of what it's there for, I think that's so great. Again, hearing how patients are using it before, after, during treatment. They're not even in treatment. If they see a bell, they want to give it a ring. But it's great because patients can use it when they need it. It's it's there for them. Do you need a little hope? Do you need a little inspiration today? I think that's great. And again, the fact that it's removed from the space where people are in the trenches of treatment, I think that allows people to use it without that feeling of maybe guilt or concern. For those that are aware, everyone here is not at the same stage that I am. So it allows people maybe that could have been hesitant to want to ring it just out of respect of others. Maybe it invites them to use that bell in a way that's meaningful for them.
Yeah, it's also been a source of fun for some of the children. Tell you, I was down there the other day and there was this cutest little boy down there just going crazy ringing that bell, and the mom was trying to get him to stop. And I'm like, oh no, please don't. This is a bell of hope. So it could be giving somebody hope. And she goes, really? And I said, yeah. So I'm like, it's fine. Let him ring the bell.
That's perfect. I mean, and it reminds me, even I'd have patients, or maybe not even my patients, but just being in the area and hearing other patients some patients are like super pumped to ring that bell. They ring it like a dinner bell, like they rip it off the wall almost, ringing it so hard. And I mean, again, it's like you don't want to ask someone to contain their celebration. And so redefining it, making it about hope, whether it's hope for what comes after your treatment is done or hope to get through the treatment that you're in or whatever your hope is, it allows people to ring it and not feel concerned that it's giving off some other feeling. It's all about hope. I love that. So what advice would you give to oncology nurses that are listening that maybe want to implement a similar change at their institution?
I would say, first and foremost, partner with your patients. Again, I've been an oncology nurse my entire career. And as a treating nurse, for me, the bell really only meant celebration, right? So it was a way for me to celebrate with the patients who saw a curative response from treatment or what we hoped was a curative response. So partner with your patients. And what I learned through this is that the bell, like we've discussed, can have so much more meaning and significance than just the end of treatment. So work with your patients to define what the significance of that bell can mean as well. Patients.
Absolutely.
Involve them. This is for them.
Absolutely. And I think also other cancer care departments that patients go to for parts of their treatment. So radiation is the obvious place I think of. And that's where I think I remember reading that's kind of where the bell originated.
Yeah, we have some down in our radiation areas as well.
And so I think, if you have a smaller institution and your areas are all on the same site and close together, then maybe a centralized place for all areas to use. If not, again, just talking with other areas that might have a bell or might have patients who want that bell and making sure, is there an opportunity to consistently redefine that bell across different areas might be something to consider for your institution as well. Well, Monica, it's been a really fun conversation today. As we wrap up, I just want to ask a few quick fire questions to help summarize some of our key points. So what are some common misconceptions about the bell and what it signifies?
That it's the end of treatment, and it can have quite a few meanings. And I think the cool thing is that the significance and meaning is unique and it's different for everyone.
What's something about this topic that's not often discussed, but you wish people knew more about?
Oh my gosh, right? How involved our patients were in this decision. The culmination of this project was 100% because of their voice. And without that, I don't even think this would have happened, or if it did happen, it wouldn't have happened the way it did.
And what additional training or education do oncology nurses need to better understand the bell at their own institution and how it might be affecting the patients and how it can potentially lead to a similar project?
Well, I think figuring out a way to give the patient a voice in the process is really important. Again, this is for them. Healthcare in general can be, I'm going to get on my soapbox for a minute, right? Healthcare in general, we can be pretty paternalistic in nature. And oftentimes we have a tendency to drive decisions because we, the caregivers, think that it's right. And it may not really be what the patient's goal or what the patients want, right? So engaging the patients in the decision-making process and giving them the autonomy to decide how they want to experience the bell is really important.
Well, thank you again, Monica. I think this has been a really insightful conversation, especially for those that have institutions with bells that maybe are still kind of defined in the old way. Do you have any final comments to share with our listeners today?
Just that this was such a rewarding experience. I'll never forget what one of my patient advisory committee members said when I showed up to our meeting with the picture of the bell finally being installed. And what he said is, I'm quoting directly from what he said, "This is an area we impacted that is going to outlast all of us on this committee." And that realization was pretty amazing.
That's pretty cool. Those are great words to end on. Thank you again so much for your time today, Monica.
Thank you.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.